welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. I have the pleasure of having Dr. Geoffrey Mount Varner. Hello. And he's an ER doctor, and you had a lot of success with your book, because that's what you came on here to discuss the first time you came on here.
2 times.
So let's start off with that, Doc. That book just flew.
Right. So the book, Home Alive, 11 Must Steps for Surviving Encounters with the Police, volumes 1 and 2, did extremely well. In fact, it led me to be an international and national speaker. And the whole goal of that book, it was a communal American give back. And the whole goal of that was to make sure that young folks made it home alive. They knew how to interact with the police when stopped. Funny thing is, a lot of law enforcement agencies endorsed the book as well.
Wonderful. So I got to ask you, before we get to what we're talking about, we're going to be talking about medical things today, but before we get to that, the words stop and frisk have been the words of the day over the last couple of weeks and months as we head into the presidential season, with one of the candidates having a not so great record with that. And your book talks about that. There is a psychological component to being an African-American male, being stopped a certain amount of time, knowing how to respond to that. Can you talk about that a little bit?
Yeah, so as it relates to like stop and frisk, I want to be crystal clear that my comments are not taken the wrong way. Any policy law that disenfranchises people or marginalizes people to the extent that stop and frisk did, I'm probably not aligned with it. But the impact of that was that you had many black and brown brothers, because don't forget, as a result, 75% of those, 75 to 90% of those stopped in that city were all black and brown. There's a psychosocial impact on that. It creates a stress level. It creates an anxiety level, because keep in mind, 90% of those who were stopped and frisked, they were found that nothing was the matter there. But yet they were like stopped, and they had to be touched by the police. And that happened over and over again. So there's a whole psychosocial impact, and it actually makes them fearful of the police.
So speaking of psychosocial, what does it do to your psyche as a human being, knowing that you're being stopped over and over and over for no other reason than you fit some sort of profile?
I would imagine, I have not been stopped and frisked, but if I were to put myself in that boat, I would say it probably makes you feel less than, especially if it happens while some people who don't look like you are allowed to pass without being stopped and frisked. And so it makes you feel as though you're not a complete member of that community, and you are. But again, most importantly, the last thing that we want is citizens to be fearful of the very people who are here to protect and serve them. And it takes it a step further. If as a black man that fear is generated in me, that's going to lead to my kids as well. So I think it's just very important that as a community, we make all members feel whole.
Indeed. So we're here today to talk about the different viruses and flus and sickness, but weather or whatever, just because it's winter, that doesn't mean everybody's going to get a cold, right?
Right, that's very true. That's very true.
Germs don't know about seasons.
Germs don't know about season, but there's a temperature threshold that makes it more likely for like certain germs, which is why one reason you have the flu that is seasonal. It comes during certain times of the year. So it creates like an incubator almost. So,
and also because we're usually closed in during the winter months, does that have something to do with it?
Closed in, because most flus and viruses are spread by respiratory droplets or by fomites, meaning I sneeze and you will come by and touch it, and then you touch your hand. Then you touch your mouth. So because we're all packed in, and we're all packed in more often, being close creates an avenue for that virus to spread.
And so should we get in the habit of washing our hands?
Absolutely. In fact, I would encourage everyone to carry a little pocket full of hand sanitizer and use that. And many people, this is my public service message, think that that's not as effective. No, it's about 97% effective as washing your hands with soap and water.
That's what I was getting ready to say. The fact that you're not using soap and water, that you're using this other substance to clean your hands. How clean do your hands get, really?
Let me just say this. So the Joint Commission, so as you all know, I'm an ER doctor. The Joint Commission nationally has regulated that there needs to be a certain number of soap dispensers outside of every patient's room, and that's just simply, and you're on to the next patient. So that says there's a certain level of trust and testing that has already been done that says that your hands are pretty clean after that.
But everything you touch, for example, a doorknob, you're opening a door, you don't know who else has touched that door. Can we get obsessive about that?
I am obsessive about it.
Oh, you
If I touch a doorknob, especially when I'm in the hospital, and I've seen people do this, and I find this very interesting. I've seen people do this in restrooms. They'll wash their hands, spend a lot of time, and then they'll go and touch their handle. Oh no, you grab a paper towel and you open that handle. So you should be obsessed with washing your hands, even in your own home. Wash your hands as much as possible.
What about the people around you? If you're, for example, if you're in a class or something, or you're in a close, and someone's, or on an airplane, and someone's hacking it up, how can you protect yourself?
One way is there's an air conditioning vent that blows air. You can open that, or you can wear your own little mask because a closed-in environment where someone's coughing, sneezing, it's spreading those droplets around. So you do put yourself at risk.
Now, I recently saw with the coronavirus, because that's what everybody's talking about, people everywhere are wearing masks in that community. But I've heard that those masks, are they really doing anything?
So, great question. There are different levels of mask because they're different filters. And to your point, let's just say that a mask with large filters are better than no mask at all. They are comparing it to the professional mask that we use in hospitals, and it has a smaller filter, so it's more difficult for viruses and bacteria to get in. But back to my point, a mask is better than no mask.
Okay, so when you go on whatever site to buy your mask, what do you look for? Because everybody's going to get their masks just in case. What do you said that it's a matter of what the filter is.
Right. So there will be levels of filter tied to the mask. I don't recommend going to Amazon because I don't think that they carry as much information, but if you go to a professional site, it will tell you the different gradings. And there's a humongous difference in the cost as well.
Okay, so the people who are running around with these masks with the coronavirus, some masks, some protection is better than no protection at all.
Right, but if you want to look at the difference, look at the differences when you see the CDC people with the mask on. Look at their mask. It's a HEPA filter mask, which is a lot different than the mask that you see people walking around the subways with.
So we're seeing more and more of this coronavirus. What do you think the impact, because some people who were on a cruise just got back to the U.S. And some of them have been diagnosed. I think it's 14 have been diagnosed with the corona. What do you think about the impact it's going to have here?
The impact that we're going to have here, we're still not sure, because keep in mind there's only been 57 cases in this country. And we have decreased travel. Watch the China numbers, because as the China numbers, the number of cases and the number of deaths go up, there will be a correlation with America. What that correlation is, we don't know. But let me make people feel better. The coronavirus has the same symptoms as the flu: cough, fever, body aches. The biggest question is, have you been exposed to someone who's been to China? So if I develop a cough and fever now, if I haven't been exposed to anyone who has been to like China, then it's very likely it's just the flu. Then your question is going to be, well, how do you know if you've been exposed to someone who's like been to like China? We really don't know, but the odds are, don't forget there's only 57 cases. There's several billion people in this country. So the odds are in your favor that your cough and fever is not the coronavirus, unless you've been to China or you know you've been exposed to someone who has been to China.
How do you, because we are in that season, how do you prevent from getting exposed to that when it comes to the flu? It's still the flu shot. Is that still your best bet?
Yes.
Because this year, some people, my son got both A and B. So this year, is the flu shot covering everything it should?
That is a great question. I'm glad that you reverted back to the flu. So the coronavirus, that's secondary. Most importantly in this country is the flu. Most flu shots, in fact, none of the flu shots cover for all strains. It covers for the most common predicted strains for that season. And once you get a flu shot, does it mean that it doesn't mean that you will not get it? No, it does not mean that. It means you are less likely to get it. If you've had a flu shot and you get it, your symptoms are not going to be as bad. Your course is not going to be as bad. So in summary, I still highly recommend the flu shot, especially for those who are very old, very young, or who are immunocompromised, diabetes, chronic ailments. It's extremely important for those groups of people to get the flu shot.
I know my dad, who's 90, he has been hospitalized twice for the flu. And he gets the shot every year, but every year. So do you think they predicted, are there years where they don't predict properly what the strain is going to be? Do they do better some years than others?
Well, they absolutely do, just based upon the word predict. So there are some years that their predictions are more right than others. This year, I think that as the weather changes, because we talked about the weather playing a role in the incubation, as the weather changes, we've got to adjust our predictions. So there are some years that they're better, and there are other years that they may be a little off.
So with the weather being warmer, we have had one of the warmest winters we have ever seen. With the weather being so warm, does that make it better or worse?
It makes it is a mixed bag, because while it's been warmer, we've had days where it's colder, then it's warmer. What that happens is that people go out and they're exposed to like more people. And then it gets chilly for a while, then they go back in. So now you have more people carrying the virus and risk exposure to like other people. So it is a mixed bag.
Have you been seeing come through the ER? I understand that it's really affecting children this year. Have you seen that?
Yes, I have, and I've seen that there's a greater cough associated with this, and a longer cough. Usually, for my flu patients, I see them feeling better in general, from about 7 to 10 days. They just feel better. But I've noticed that this chronic lingering cough this year, which is different from what I've experienced in my last 20 years of practice.
So should you go and get tested if you have certain symptoms? Because a lot of times people don't know, do I have just a basic cold or do I have the flu?
That is an excellent question, and you should get tested, and here's why. Because if you get tested and they do a swab and that culture comes back, or that test comes back within hours, sometimes minutes, and it's positive, if you have had your symptoms for less than 72 to like 96 hours, there are medicines that they can start you on. So instead of you being sick, say, for 14 days, once you start the medicine, you may be sick for 5 to 7 days. So you should absolutely get tested, especially if you're immunocompromised, the very old, the very young. And even if think about if you're self-employed and you're not paid while you're off, it's very important to get tested so that you can go ahead and start that medicine right away.
So when you do take the medicine, it cuts the duration.
Exactly.
Do you find some people want to take care of it themselves and want to use some kind of, over-the-counter things? Is that going to suffice?
If it is the flu, it treats the symptoms, but the duration is probably going to be just as long, and the intensity is going to be greater. I highly recommend getting tested so that you can start the appropriate CDC recommended drugs. Now, don't get me wrong, over-the-counter makes you feel a little better, but it's the doctor prescribed medicine which is going to be the most benefit to you.
Have you been seeing, because I just recently, Elton John had to cancel a concert. He was on stage. He was sick. He had walking pneumonia. Do you see a lot of that this time of year?
Absolutely. And that's one of the, for lack of a better word, that's one of the complications of the flu. Walking pneumonia is exactly what it is. People are still up, about, living their like normal lives, a little more short of breath, coughing more, not feeling as well. That's why it's called the like walking. And this flu season, I've seen more of it, and I've actually seen it more of it in children and the very young being pediatric age to about 24, 25.
And so what are the symptoms of that are similar to the flu?
Yes.
How do you know that it has gotten to pneumonia? Is the only way you can know is to be tested, or does it just kind of knock you down? Because I know the flu knocks me down.
Right, right. Well, the walking pneumonia treats the very young differently. They may go on and never come in, and they can get better. Not all of them, especially if it's due to a bacteria. Bacteria, more often than not, requires an antibiotic. So if you find yourself getting more short of breath, coughing more, fever's not getting better, then you should you should probably go get tested sooner. But I want to be clear. If you develop these symptoms, you should be tested right away anyways.
What is the difference with pneumonia? Is that dealing more with the lungs?
So yeah, pneumonia is an infection in your lungs. As your audience knows, we have two lungs. Usually pneumonia is on one side, and that is usually treatable. A pneumonia can be bacterial in nature, which means that antibiotics will help, or it can be viral, which means you need supportive care. That may include the like Tamiflu that we use for the flu, and it just may include supportive care as well, like fluids, rest, and so forth.
Do you see it putting people in the hospital?
Absolutely, especially, and I know you're wondering why I keep mentioning this, because it's very clear, especially the very young, the very old, and those who are immunocompromised. If that class gets the pneumonia, it's very likely going to wind them admitted to the hospital.
And that is definitely not where you want to be.
That's not where you want to be, especially this time of year.
What about kids in school? You know, you're in that closed environment. In the winter times, you're not going out to recess as much. What can we tell our kids as we send them to school and somebody wipes their nose and touches you? You know, I mean, it's just kids, they're just germ factories.
You're right. You're right. Well, first you go home and you buy your kids a pocket hand sanitizer and tell them to wash their hands as often and as much as possible, and don't put their hands in their mouth. And secondly, and don't forget, I have kids who are still in middle school. You talk to the other parents and say, hey, your child has a fever. Don't send that child to school, and don't do the motion Tylenol game. The motion Tylenol game is you wake up in the morning, you know your child has a fever, but you don't have daycare, or you've got an important meeting. You give that child some Motrin Tylenol, the child feels better, and therefore you send them to like school. It masks the like fever, and so you send an infectious child to school, which will infect the other classmates.
And parents do that all the time.
Yes, they do.
So what can you tell your kid about staying away from that?
Most importantly, if you have wash your hands as often and as frequently as possible. 2, don't put your hands in your mouth.
How about touching your face?
Touching your face, as long as it's not touching your mouth, that's fine. But I would recommend just keeping away from your from your face, period. But most importantly, constantly washing your hands. That is most key. And if you have a classmate who you know is sneezing and has a cold and maybe a fever, you should talk to your teacher. Say, hey, is it possible that I can sit someplace else today?
And is there a time period? Should you wash your hands for 30 seconds? Is just a rub okay? Is there a time period that you should be lathering? And should you make sure you lather, or is it okay to just rub a little bit?
If you're using soap and water, a good 30 seconds is nice. If you're using the hand sanitizer, just plenty of hand sanitizer where your hands are wet and you're getting front and back, and then you're ready to go.
What about the fact that it can really dry your skin?
Absolutely. Hand sanitizers, it definitely dries your skin. For adults, I highly recommend carrying a moisturizing lotion with you as well. And if you want to give it to your kids, fine. But most importantly, everyone carrying a little bottle of that hand sanitizer will help us all.
You know, another thing, people come to work and play that game. They don't want to miss a day of work because they've already taken enough vacation and they don't want to lose time. So they'll come to work sick. And I know, working at a radio station, we share a microphone. And people will come to work sick. And it's like, let's scream, don't do that.
Yeah, don't do that, but we all know that it happens. And the medical world is just as guilty of that. As you know, I am an ER doctor. The difference about us is that we do shift work, which means that we cannot leave that shift until the next doctor gets there, which means that we expect you to show up to your job unless you are admitted to the hospital. So there's often an expectation that you're going to show up. If you've got a little cold, we still expect you to show up. The difference is that we've got the resources to put on masks, the appropriate masks, put on gloves, constantly wash our hands. In your case, I would say that's where the hand sanitizers come in. And you like talk to your colleagues, obviously, but then you wipe behind them everywhere that I go, especially that mic.
And what we do too is we wipe down the console.
Yes.
You know, or I do.
Yes.
Before I leave, I wipe down the console, and you can't get everything, but something is better than nothing.
Right. Right. I try to get everything. I get the seats, I get the desktop. I try to get as much as possible. And I think that in this day and age, especially during this season, people should be understanding and they shouldn't take it as personal. You're simply trying to not only protect you, but trying to protect your family as well.
And let's go back before we run out of time. Let's go back to the coronavirus one more time. Is there, you said the good news is the likelihood of us getting something like that is slim because so far it's only like 50.
Right.
In the country.
Yes.
So unless you've been in contact with someone who has come back from China or whatever, don't get overly concerned. Let's not.
Absolutely. So the summary of what you just said, a fever and a cough is what are the common symptoms of the coronavirus, but it's the same common symptoms as the flu. What connects you to the coronavirus is a fever, a cough, recent travel to China, or contact with someone who has recently traveled to China.
Let me ask you another question dealing with the fact that we've had such a warm winter. Does that bring certain things out, for example, ticks? Bring that out and cause things like Lyme disease because it's so unusually warm?
Yes, so ticks will probably be out sooner. And so the more we're out in our yard, the likelihood that there's a greater likelihood that you can get a tick bite. But it's interesting that you would mention ticks, because ticks have similar symptoms, except the fever and the cough is not there, meaning that you get these body aches, you get these unconstitutional symptoms, meaning that you don't know what they are, but it can be related to the tick bite, which is usually Lyme disease.
And also, doesn't it cause some kind, just a small rash?
Yep, a small
I used to live in
circle.
Connecticut in the woods.
Okay, I got it, clearly.
We lived in a very rural area of and it was so common there. And I remember them saying that it causes this small type of rash.
A small circular rash with like central clearing. If you have that, even if you don't see a tick, it means that you could have a tick bite there. And because of the prodrome, because of the lasting effects, you may not feel bad then, but it's very important for you to go get tested, because that's one of those that if you do have Lyme and you do not treat it long term, it can have horrible effects.
Are there long-term effects? We've been talking about things like the flu and pneumonia. Are there long-term effects if you don't take care of it? If you've been walking around with this pneumonia for a certain period of time, what are some of the consequences?
Well, if you are very young or very old, the consequences are going to come then. But for the middle-aged healthy, the flu is a virus, and technically, we don't have a cure for any virus. All the treatments that we're giving is extra supportive care. So the virus is going to, the flu is going to play itself out eventually. You are eventually going to feel better. Without the medicine, it's going to take you longer to feel better.
Wow. So just wash your hands is one thing. And another thing, men going to the doctor. You've got a husband with a hacking cough, or you think he's got some. How do you get you guys to go to the doctor?
Make the appointment for him. Make the appointment for him. And most importantly, make the appointment for him. And depending on his age, make sure that he gets his PSA checked. Make sure he gets his colonoscopy screen, especially if he's over the age of 50. But he can start getting his blood pressure checked right now. But actually making the appointment and going for him or going with him are key. Because you're right, 70% of men don't go regularly.
So go with him?
That's the best way. Go with him, make the appointment.
And should I ask the questions too?
Well, I wouldn't recommend going in the room with them, but at least go with them, walk them to that front desk and say, hey, honey, I'm here waiting for you.
Because a lot of times my husband will look at me when they ask certain questions. Because he knows I know the history.
Right.
You know, and because recently we did a colonoscopy thing, and I knew that his mother had a history of some things and he had forgot. So, I mean, it's like sometimes the wife knows some things.
That's very true. That's very true. It just depends on that relationship with that couple. But a colonoscopy, great example. Just real quick, that's one of the few tests that colon cancer, if caught early enough, is 90% curable. So a colonoscopy can literally save your loved one's life.
Wow, very good to hear. Any last thoughts?
Last thought is be safe out there, wash your hands, wash around you as well, and make sure that your loved ones wash their hands and wash around them as well.
We know the Varner home is washed out.
We do a lot of hand washing.
We've been talking to Dr. Geoffrey Mount Varner. He is an ER doc and one of my favorite guests.
And I always feel special whenever you ask me to be here.
You've been watching the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Have a great day.